my focus, why I became a pediatrician, and one of the main reasons why I became a pediatrician is because I thought I could make a big difference in the area of prevention. So that is really key for me. And in thinking about what I was going to talk to you today, at first I thought, well, I'm not really a specialist in patients with special needs. I mean, I deal with all pediatrics, so that's really not my specialty. But when I thought about it, I said, but what I deal with is the family. I not only deal with the special needs child, but I deal with the entire family, the parents, the siblings. So I thought it would be a great twist to really talk about the special needs family from the perspective of a pediatrician. And so from my perspective as a pediatrician, the family of a special needs child is extraordinary and extremely special. The family has to deal with the physical, the emotional, the economic, and the social challenges of raising a child with complicated medical needs, while at the same time dealing with the needs of the other members in the family unit. So it's all about juggling and running here and running there. And so remaining cohesive and fostering strong, healthy relationships with each other is often difficult because the needs of the family may be put on the back burner because they have to attend to more pressing needs at hand, getting the child the medical care they need, running to the different specialists, going to the different schools. So as a pediatrician, I see that from my perspective. I see the complicated issues they have to deal with day to day, dealing with the medical issues of the child. But I also talk to the siblings. I deal with the parents. So I see really the whole picture. So, and as caretakers, and in my talk I'm going to speak, because I know we have a varied audience, so I'm going to speak to both caretakers, parents, family members. As caretakers, we must not forget that the overall well-being of the family members impacts the overall well-being of the child, impacts the overall well-being of the whole entire family. So, what's to come? In preparing for this talk, I realized that when I see a patient from day to day, my focus is on taking care of the patient, the child's medical care, and their health. And there is rarely any communication about the overall health. And when I say health, I mean more the emotional and the social well-being of the parents, of the entire family. The parents generally don't communicate about stressors. And they tell me what they're doing and what they're busy doing, and they're going here and they're going there, but they really don't tell me how they are. And by the time we go through all of the issues that we have to deal with in the 20 minutes or 15 minutes or 20 minutes of time that I have in the office, there's really not much time for me to ask. And clearly, there are a number of stressors. And we're going to discuss the impact that these stressors have. There's an impact on the family, there's an impact on the marriage, as Ms. Von Peer alluded to, there's an impact on siblings, but we also have to realize that there are positive outcomes and solutions about raising a child with special needs. Now, 1 out of every 10 children are born with a special needs or a disability. An individual is considered to have a disability if they have a physical or mental impairment that substantially limits one or more major life activities, such as walking, seeing, hearing, speaking, breathing, doing the tasks of everyday living, learning, caring for oneself. There are more than 6 million people in the United States with special health, developmental, and mental health concerns. And there are about between 10 and 20% of children have some type of long-term illness, disability, or other type of health impairment. About 2% of children have chronic illnesses that seriously impair their ability to accomplish the usual activities of children their age. So that just gives you a little sense of the statistics. Now, this is a quote that I really like. It's by Irving Dickman and Dr. Sol Gordon, and they share this in their book entitled One Miracle at a Time. It is not the child's disability that handicaps and disintegrates families. It's the way they react to it and to each other. Finding a way to deal with the additional stresses, minimizing them, overcoming them, by sharing them can glue a marriage and family together more firmly than ever. So when attending to a child with special needs, try to identify stressors within the family and direct them toward resources, especially some of the resources we hear today that I'm going to use. That might be helpful to them in really managing life's challenges. Often parents and the siblings don't realize how overwhelmed and emotionally fragile they are until they're completely run down and exhausted. Families must learn to cope with the continuous challenges they will face due to the special needs of their child. They must learn to deal with the stress and strain that disability creates within the family, because it will create stress and strain. There's no doubt about that. They must learn to deal with the family's reaction to the child with special needs. Regardless of the type of the need of the child, the parents must learn to cope with the fact that their child will never fulfill on the initial expectations they had. Their child is a great child, and they will fulfill on something, but not those dreams that you know, when you dream about having kids, you have this ideal picture. And so they just you have to come to terms that it may not fit that picture you had in your head. Impact on family. Every family has a balance system. After learning about a child's chronic illness or disability, there's some loss of equilibrium that can threaten the family's stability. In some instances, in a lot of instances, the parent becomes consumed with the care of the ill child. That's all their focus is, and rightly so, because there's a lot to manage. There's a lot of things to juggle. But they do this at the expense of nearly everything else in their lives. They're consistently seeking new treatments, another doctor's opinion. What else can they do? I mean, the impact can be seen in and read in Jodi Picoult's book, My Sister's Keeper. It's a dramatized version of it, but the parents of that chronically sick child with acute promyelocytic leukemia actually had a genetically matched child, so that child can donate bone marrow and really help the sick child get through life. And that was a demonstration in the movies and in the book of the strain that can create. And that's based on reality. Communication, I can't stress this enough, and you'll hear this more than one time in this talk. Communication is extremely important in these circumstances. When we, as average human beings, are stressed, we often stop communicating because we're focused at the issue at hand, and we don't want people to know that we aren't quite handling things as smoothly as it appears. Members of a special needs family are no different. They may look calm and cool and collected on the outside. In reality, they may be resentful, sad, frustrated, and lonely. As a pediatrician, I must admit that I have intuitively known this, but I've often, in practice, buried my head in the sand, just looking at what I have in front of me, because I'm afraid to ask more probing social and emotional questions. Why? Because I'm afraid of opening this huge can of worms that I don't feel prepared or equipped to handle. So tips on maintaining a healthy family. The truth is, as healthcare providers, there's nothing for us really to handle. There's nothing to handle. All it is providing a space to talk for parents and family members and the siblings and the child themselves to communicate, and then directing them to the appropriate resources. I highly recommend counseling for the entire family in order to equip members with the appropriate coping strategies to manage the inevitable stressors that will come their way. Support groups are also invaluable. Pay attention to the moods of the family. As parents, you have to pay attention to the moods of the family. And as healthcare providers, we need to really pay attention to what's going on. If you notice signs of depression or other changes, like the siblings are hanging out with the wrong crowd or acting out, really guide them to get help. Make an effort to keep the family's life, and when I say as normal as possible, it's not really normal. What I mean is routine, and that's very difficult to do. But make sure there's some type of structure, maybe one thing that you can do on a regular basis that everybody can kind of count on, just to create some sense of balance. Taking care of the physical and emotional well-being is very important, of the whole family, of the siblings, of you as parents. Really, you have to replenish yourselves so that you can continue to give. You really have to fill up the gas tank. Respite care, as was mentioned before, is extremely important, and I urge you to seek out opportunities to do that. And spending time with not just the child with special needs, but spending time with the other siblings in the family is also important. It's not quantity, it's quality. Even if you can, have a small amount of time, an hour a day or an hour a week, but some time where that other child knows that you care about them. And of course you care about them, but the other child, when the attention is always on the sibling with the special needs, usually doesn't think that. There's a huge impact on marriage. When you first learn that your child has a chronic illness or some special problems, you can be emotionally overwhelmed, and the reality is that your life will never be the same. It just won't. It'll never be as you had planned. Your marriage, like anything else, will be challenged and stressed. I mean, even if you didn't have this, your marriage would be challenged and stressed. So the key is to communicate your feelings to each other and to openly express your thoughts and feelings to one another. Now, these are just a few of the feelings that you're going to deal with: sadness, worry, denial, anger, guilt, resentment. And the guilt is you're really guilty that you're feeling all these things. When I was preparing for this talk, I actually spoke to one of my parents who I see their child and they have special needs, and I say, I'm doing this talk and I've never really done this, but tell me a little bit about what you're going through. And as I said before, I never really took the time to delve into that, and they were like, "Oh, let me tell you," and it was amazing to really find out, and they really appreciated the fact that I asked. You could tell that. Finances is a huge issue, and this one parent said that they have great health insurance, but they pay $3,000 per year just in copays for prescription medicine. And that creates a lot of strife around the marriage. And what also is impacted is jobs and employment. Because especially if it's a two-parent family, and some families there's just one parent juggling things. If it's a two-parent family and both parents work, they're kind of arguing about or kind of trying to manage whose turn it is to take the day off. And they have to be fortunate enough to have employers that are understanding that they're going to take the day off. So, and a lot of that frustration about it's not my turn, and I did it, and now it's your turn, and what are my employers going to think, and are they think that I'm going to make it up, and all of that causes the strife in the marriage. Sexuality and intimacy is extremely low usually because you're managing other things, you're stressed, who has time to really think about dealing with one another. Spirituality can either be, they can move towards spirituality in this instance and become more spiritual, drawing on their faith. Or they can be more withdrawn from their spirituality because they have no time to go to church, no time to worship, no time to read. Social life, the parents said, social life, they said, you really learn who your friends are quickly. Because, there's no time to pick up the phone and say, oh, happy birthday, or there's no time to go to different events, and often they forget major life events of their friends, so they really get to know who's supportive and who's not. And future plans and recreation, it's really difficult to plan. You can plan a vacation, you can plan a trip out, but if the child gets sick, all plans are gone, and then you have the sibling who was excited about going to Disney World or excited about going on this, on this family trip, who's again disappointed because something came up. And one phrase that was very interesting that this mother said is that you learn to juggle so much that you really forget to even breathe. I mean, it's like you're always holding your breath. You're waiting for the other shoe to drop. You're just running. You never get a chance to breathe. Impact on siblings. While having a special needs sibling presents challenges, before I go into the challenges, I also want to go into the positive outcomes of having a special needs sibling, because children that grow up with a sibling with special needs may have the chance to develop many good qualities and characteristics, including patience, kindness, really being flexible and adaptable, going with the flow, being helpful, responsible, compassion and empathy for others, and really coping with challenges and a sense of loyalty. So it does create a different type of a child that's raised in this atmosphere. But they're also dealing with difficult feelings, the same, really, a lot of which the parents go through. Worrying about what's going to happen to their sibling. Are they okay? They're going in the hospital. Are they going to come out? Scared, angry, and resentful about all the attention that the child is receiving, and they're not getting as much attention. Pressure really to, they don't want to cause any more trouble. They see all the trials and tribulations their parents are going through. They don't want to rock the boat. Jealousy because of the attention, and also guilt. They're really guilty that they have these feelings. Now, I said I cannot stress enough, however, communication is key here. Parents need to be open to listening to the frustrations and concerns of all their children and be willing to ask questions like, what's it like for you when I have to take Jimmy to his doctor appointments? Or what was it like for you, Sarah, when we had to cancel our plans to go on vacation because your sister had to go in the hospital? And those are tough questions that, as parents, we really don't want to ask because we really don't want to hear those answers out loud. We know that our children are disappointed, but we don't want to have to hear it. But I think it's important to inquire about it and to talk about it. So there's that dialogue that's created. Because when things are brought in the open and put on the table, you can actually deal with something. When they're not, when they're hidden, then that's when it comes out in physical symptoms like chronic abdominal pain and headaches. And I see a lot of kids in the office, and they come with chronic abdominal pain and headaches, and we do the $1 million workup and the X-rays and everything, and nothing's there. And it resolves just as spontaneously as it came. And if you're not communicating by mouth, the stress and the angst comes out in some shape or form, and it can manifest itself physically. Red flags are changes in eating or sleeping habits, hopelessness, poor concentration, low self-esteem, really the desire, I have to be right, I have to do it right. Of course, these are huge red flags, talk of hurting themselves, loss of interest in activities, frequent crying or worrying, withdrawal. Those are red flags which really mean you have to address this immediately, counseling, talk to your pediatrician, find the resources that you need. Tips for helping siblings cope. Really, as I said before, acknowledge their concerns and emotions. Their concerns and emotions you may not agree with, but they're all valid. Your kids have to be heard. They have to be heard, and they have to be known and appreciated for their opinion, their thoughts, and recognize that you value what they say and what they say is important. Keep them informed. Don't try to hide things from them. Keep them informed about what's going on in an age-appropriate way. Really tell them, well, we're going to the hospital because, Johnny's sick and the doctors are taking... So, because kids know. I mean, they're very, very smart. And if you don't tell them the specifics and if you make up a story, they're going to know something's wrong. And if you don't tell them the truth, they're going to make up something that's not the truth. They're going to come up with their own story. And you may not, their own story may be much more grandiose than what the truth is. Expect typical behavior from siblings. I mean, siblings are siblings, and if you have a child with special needs, there's going to have that same, bickering, the same fighting. Don't expect anything differently. Really, a lot of times we tend to hold the siblings to a higher standard, but they're it's a family. So you really have to realize that. You really have to understand that. Let's see. Positive outcomes. Although having a child with special needs might seem the last thing you ever dreamed of, many families do discover that there's a positive side to this. Parents are often closer to their sick child than they normally would be. They learn to share their lives and help others in similar situations. A lot of the parents become leaders. They may not meant to have been leaders, but they become leaders because they've done the research on the particular aspects of the problem. They're advocates for their children. They lead parent support groups. They're a wealth of information for other parents who are going through it. They learn how to juggle, and time management is very important for them. They're adaptable, they're creative, and very patient. The development of the medical home model that's really talked about a lot today may be the answer to how medical care is managed for a special needs child. When I see a special needs child, the parents seem to be the coordinators of the care. They come to my office, and I get letters from all the specialists, and I read the letters and I put them in the charts. But the parents, when they come for their visit, they're telling me, well, Dr. So-and-so, the neurologist said this, and he put him on this, and I went to the pulmonologist, and they're taking this nebulizer treatment, and they're doing this, and I went to the GI. So really, they are, I think, in the present model, the real coordinators of the care. Everyone, all the specialists, including myself, are effectively managing our own areas. I'm doing the primary care, and I'm the ear infections, and I'm kind of coordinating, just finding out, what's happening. And the neurologist is dealing with the seizures and the ADHD or the developmental delay, and the orthopedists are dealing with their ambulation issues. The pulmonologist is dealing with the asthma or the trouble breathing. So we're all effectively managing those health issues, but there's really not the parent is the one looking at the big picture, the whole child. And the shift to an outpatient team-based approach will certainly be a benefit and will enhance the care of the patient and family. If physicians, parents, social workers, nurses were all in communication about the management of the patient, it's like if a patient was hospitalized and there's a team approach and you have a team meeting, the parent's burden of managing the child's care would tremendously decrease. It may, in fact, give that parent who said they hold their breath all the time, it may, in fact, give her space to breathe and a place to exhale. So as a pediatrician, my goal is to provide the best possible care for all children and their families. A child with special needs has complex issues to deal with, physical, emotional, and social. And in my experience as healthcare providers, we are taught to zoom in on the particular problem we're trying to deal with, we're trying to handle. But we narrow our focus to find a solution. And in doing so, we forget to take the bird's eye, panoramic view of the whole situation. The special needs child is part of a family, and we have to address the needs of the family in order to adequately take care of the overall health of our patient. Communication, recognizing and acknowledging stressors, working together as a team are essential components of taking care of special needs families. Remember, the health care of the special needs patient is intrinsically and extrinsically tied to the health of the family. Thank you.